call up Senate File 2128 with Senator from Webster, Senator Beall, and Senate File 2112 with Senator Ernst. Seeing no objections, so ordered. The chair would recognize the senator from Webster for Senate File 2128.
Thank you, Mr. President. First of all, I apologize for my lack of a voice. I guess I shouldn't have filibustered yesterday. You may recall that 2 years ago, Senate File 1, that I dubbed Drew's bill in honor of my grandson, Drew Beall, who has autism. This would provide applied behavioral analysis and other treatment, early intervention for Iowa's children with autism. You may also recall that this bill was scaled back, and so that not all Iowa children were covered, but only those of state employees. You may feel that this is rather elitist. It sounds that way. Actually, rather than being elitist, it's a result of the legislative process itself. In spite of the lip service we pay to long-term and comprehensive planning, we oftentimes do things in a rather piecemeal and incremental way. And so it was with Senate File 1. Actually, in retrospect, I view that it's been in practice for 2 years now as a pilot project. And it's done two things. It's shown the efficacy of applied behavioral analysis and other treatment for children with autism. And it also demonstrated that it doesn't break the bank. The average family coverage for those state employees who were covered is about $1,800 a year for their insurance, or about it figures out to be about 26 cents a month added to your insurance bill. My grandson Drew lives with severe autism, but he was born into a very great home. He couldn't have been born into a better home. My son Scott is a special education teacher who worked one-on-one with an autistic young man, and my daughter-in-law Kim worked at a group home for children with autism. Before he was 2, Drew could count to 20, and he could read license plates. Before he was 2 years old, that he knew a 9 inverted was a 6. And about somewhere between 18 months and 2 years old, he quit communicating. This very verbal and bright little boy quit communicating, and he started to self-stimulate. Ironically, as a result of the scaled-back Senate File 1, Drew Beall is not eligible for Drew's Law. Senate File 2128 corrects that and expands coverage for most all of Iowa's children living with autism. The autism spectrum disorder is very broad. As I mentioned, Drew is quite severe, but it's a spectrum that includes everything from Asperger's, which is rather mild, to very severe. I was doing due diligence yesterday on the governor's appointees to the Autism Council, and one of the governor's appointees that I talked to is himself autistic. Very high-functioning gentleman, full-time job. He's an IT manager for a major company here in town. He has Asperger's. I really appreciate the bipartisan effort that's gone into this. Senator Bill Anderson has been a tireless and passionate partner on this. I'm just as proud as the product. I'm just as proud as the process as I am the product. What exactly does Senate File 2128 do? First of all, group insurance policies will now provide coverage benefits for the screening, diagnosis, and treatment of the entire autism spectrum disorder. Coverage benefits age out at age 26. The autism spectrum disorder includes the autism disorder, Asperger's disorder, and pervasive developmental disorders, according to the American Psychiatric Association's Diagnostic and Statistical Manual of Mental Disorders. There's a cap on benefits. As I mentioned, the average cost per consumer was about $1,800 for those state employees, far less than the maximum benefit at $36,000. Mr. President, there is an amendment.
There is an amendment, Amendment 5065 by yourself. You are in order.
This amendment, 5065, represents the hard work of all of the stakeholder groups. We brought together the Autism Society, Autism Speaks, psychiatrists, psychologists, and others. This is a compromise among stakeholders. Among other things, the phrase autism service provider is defined. It allows for the diagnosis, limits the diagnosis to only licensed physicians and licensed psychologists. There is some fear that naturopaths or other people, professionals, would be able to do that. This limits that scope of practice. It defines rehabilitative care as defined under Senate File 2128 language.
Senator from Webster, final remarks.
Thank you, Mr. President, and my friends and colleagues, Senators Anderson, Bertrand, Riley. Thank you for your heartfelt comments. Fiscally, this bill could save the state of Iowa money. I see it as saving money, not costing. Why? Because in waiver costs, it will reduce those. The cost of ABA, applied behavioral analysis treatments, covered here are expected to be recovered through reductions in educational and medical expenditures alone. Other costs of care also will be reduced, and the productivity of individuals with the autism spectrum disorder and their caregivers will improve, in addition to the non-economic quality of life benefits. Autism costs this nation over $35 billion a year, and it's expected to increase substantially over the next decade. As was noted, the utilization of this by 146 families on the legislation that was implemented in 2010 was a total of $281,000. That's less than $1,800 a year per family. The cost of that was 26 cents per insurance per member per month. As I noted, there is a cap of $36 million on this. You'll notice that I wear an autism pin. It has puzzles. Autism is a big puzzle. We feel that there are both environmental factors as well as genetic factors. The truth of the matter is, we don't know what. What we do know is that about 1 out of 100 boys born today would be diagnosed with autism, a higher rate than with girls. Overall, boys and girls, it's 1 out of about 150. So friends and colleagues, this bill, as has been noted, is bipartisan in nature. It actually saves money. It works. It preserves the dignity of young people. And I'm very grateful to my colleagues, the co-sponsors, those speaking on behalf of this today. Autism Speaks, the Autism Society, the Psychiatric Society, the Psychological Society, and other groups. But what really comes down to are kids that oftentimes don't have a face or a name in the halls of power. And were it not for their moms and dads and grandpas and grandmas, we would probably not be debating this today. So it's with a heart full of gratitude to my friends on both sides of the aisle for bringing this to a debate today. I thank Senator Gronstal for allowing this during the final funnel week. I just urge you to support Senate File 2128. Thank you.
Result of the roll call. Those voting aye, 43, no 7. The bill having received constitutional majority declared to pass the Senate and the title was agreed to. We'll now call up Senate File